Hey, welcome back to the next video. So you guys are doing great now. So just keep practicing. We covered already seeing size up. We covered the primary assessment. We did the history taking. Now we're going to go into the secondary assessment. The secondary assessment is the assessment in which you're going to look where you're going to vector or focus on one specific the complaint. So today we just gave you the chest pains complaint. Another day we'll do other types of scenarios. But for today we did this one. So now we're going to look into the thing. Now, at this point, you can do whatever you want. I mean, in a sense of this, you can either do vital signs now. You can do an assessment, and you can treat. So we're going to do, let's say, the vital signs. Okay, so vital signs, you're going to go right to the blood pressure. We can assess the pulse, which you guys have practiced with that during vital signs. You check the pulse, you check the respirations. The pulse you check for 30 seconds, times it by 2, the rate, the rhythm, the quality. Then you check the respirations, the rate, the rhythm, and quality. And then you can check the skin, all right? You can check the pupils, and that will be it for this vital signs. Okay, keeping it very simple. You check the blood pressure. You give the instructor the blood pressure. You give the pulse. For example, you might say patient's pulse is, 88 strong and regular. Respiration is 16 full and regular. And from there, you can check the skin, warm, dry, unremarkable. Instructor will tell you whatever the scenario is. Then you can check the pupils, shining the light, which we cover that in vital signs. Pupils are equal, round, and reacted to light. You can say that, or some schools will say pupils are reacted to light. So it depends on what school in the teaching. Then from there, you'll move on to the head to toe. So it depends on the type of call type, the nature of illness, then you're going to do specific assessments. Now, I will be recording and doing a patient assessment lecture. I'll be posting that very soon. And in there, we'll give you specifics. It's just more of a lecture form. Here's just more practice. So we do the vital signs, and the next will be the head to toe. So in this case, you will do assessment of the pupils. Pupils are equal, round, and reacted to light. Then you can check the lips for cyanosis. Then here you're going to assess having the patient turn from left to right for jugular vein distension. Then you can, depending on the school you go to, you can have mid-clavicular, you check on one side and the other side, mid-axillary, one side and the other side, the bases, and other places they'll show you 2 other places more in the upper back and lower back. All right, so you can do six lung fields you check. In other areas you can, other places you would do 10 or 7, whatever it is, but you would check according to your school. So once you do the assessment, then you move on, and then you move down to the abdominal area and assess for ascites. Ask the patient, have you noticed any abnormal swelling of your stomach? Nope. Then you're going to go to the hands. These are called carpal edema, fluid retention here. You're going to press down, and looking for any dimples. Then we're going to go down to the legs, checking for pedal edema. Just doing that. And that's pretty much it. And the next part of the assessment is your treatment. Now, I'm going to leave that to your local protocol, because this video can go from East Coast, West Coast, North, South, different regions, but I'm going to leave it to whatever the protocol states. All right, and this will conclude the secondary assessment. Okay, so I'll give you an example. So from here, I will start with the vital signs. So I'll check the blood pressure, which you guys already did before. Check after the blood pressure, then I check the pulse, 30 seconds, times it by 2, the rate, the rhythm, quality. 88, strong and regular for this scenario. Respiration, same thing. 30 seconds, times it by 2. Next do you know, 16, full and regular. Once you've done that, then you're gonna check the skin. Warm, dry, unremarkable. And check the pupils. Pupils are equal, round, or reacted to light, or pupils are reacted to light. Depends, I have like 3 different versions of it. So we're done. Then from there, we do the head to toe. So we're gonna check the pupils. Then we can check the conjunctiva, check the lips for cyanosis, check the neck, turn the head to side, at a certain angle, looking for JVD. Now we could do the lung sounds. One here, make clavicular, mid-axillary. Back here will be the lower be basis, right on the rib area, just above that. 6 would be good, but other schools would teach 10. And check the upper back. So lung sounds are clear, equal, bilateral. Stomach, have you noticed any swelling for your stomach lately? Yes or no? Then I'll check for ascites. Then I'll check the legs for pedal edema. All right, carpal edema, pedal edema. Once we're finished with that, then we hit the protocols, the treatment. So whatever the treatment that the protocols state for cardiac, then you guys will read and do. All right, because one thing I can say is protocols change in different regions. Treatments would change. Doses would be different in some parts of the counties, regions, and states. So I'm just gonna leave it where the protocols based on your local protocols. So we're done. We're going to the last one. So stay tuned for the next video for the last. All right, see you then.